I'm thrilled to be here today speaking to you. I'd like to set the stage by opening with a Stephen Hawking quote from his book, A Brief History of Time. Hawking in his book explains the no boundaries condition, the idea that the universe is finite but has no boundary. The same exact concept correlates to the profession of dental hygiene, finite in nature but without boundaries. Today we're going to go through an exploration of the expanding talent of dental hygiene across 5 core pillars of leadership, diplomacy and teamwork, dental medical synergy, clinical excellence, and business excellence. I like to think of these 5 core pillars as a hierarchy of needs. We can look at it like Maslow's hierarchy of needs, and we can look at it from the foundation being leadership, and then moving through diplomacy and teamwork, dental medical synergy, clinical excellence, and business excellence. So let's unpack that. Leadership. We have to let go of our limiting beliefs about what leadership is. Everyone is a leader. We're not told this in hygiene school. No one in hygiene school tells you, you're a leader. You come out into practice, you're very unlikely heard that you are a leader in practice either. But we all have a leadership style. I encourage all of you to take a personality assessment test. And you can do a DISC, a Colby, a Myers-Briggs, or a Leadership 360 profile. But understand your leadership style so you can leverage your strengths and work on growth opportunities. I encourage you then to have your team at your offices take the same personality assessment test so you can share with each other your results and you can grow each other and help leverage your strengths. We look at leadership in all kinds of ways. One of the most important things we need to look at with the leadership is understanding that we all lead. And what does leading look like? I love the acronym L for listen, to understand. E, empathize, which will motivate you to act. A, ask how you can support. And D, deliver to the best of your ability. Moving up to the next stacking skill set, we look at diplomacy and teamwork. Gone are the days of the hygiene siloed and the hygiene diva. We need to understand that hygienists, you are leaders in your practices, you co-lead with your doctors. You just sit down with your doctors and ask them, what's your vision for the practice and how can I support that with you? What are the action plans we need to put into place? What are the key metrics that we need to be looking at to be accountable to those goals? And then bring your team into that conversation. Share with your team the goals and the action plan so you all can be accountable to your patients, providing the best optimal care. As all conversations, conflicts can arise. So hygienist, you need to come into the conversation with some conflict resolution skills. Whether that's a polarity map or some of the other conflict skills that are out there, you need to bring that to the table as a leader. Help your office navigate through difficult conversations. And understand that healthy teams and teamwork is your competitive advantage. Think about any sports team that wins championships. I'm in Chicago, so it's the Bulls for me, or it was growing up, but they have solid teams and healthy teams. They know in their team, everyone has their back, they're all there to support each other, and that is team excellence. Moving up to the next skill set, we have dental medical synergy. And again, the move here is that hygienists, we are dental medical healthcare providers. We see our patients more than any other healthcare provider. We spend 60 minutes with our patients twice a year. We're taking their blood pressures. We're doing their medical history updates with them. We're doing oral cancer screenings with them. And the expansion here is into a lot of the chairside testings. So if you're not already doing it, look at things like sleep apnea testing. We can very easily give our patients a questionnaire. There's a lot of good ones out there. Look them up, learn about them, share them with your doctor, and bring your team into the conversation. Same thing with chairside salivary testing and point of service blood testing. These things are coming down the pipeline. We're able to capture people's C-reactive protein levels, HbA1c, and share them potentially with the medical community and their providers. So make sure that you're doing that. Moving up through the next skill set level, we have clinical excellence. And please, if you're still doing periodontal charting and writing type 1, type 2, type 3, it's time to expand. There's a lot of information out there regarding the 2017 Periodontal Guide to Staging and Grading. If you're not familiar with that, get familiar with it. There's a lot of resources out there. And again, familiar yourself with the new staging and grading, share them with your doctor, share them with your team, get everybody on board about how you're going to do risk assessment for your patients from a periodontal perspective. Along with risk assessment, you should be tracking numbers in your practices as it relates to your hygiene department and your services. Are you identifying risk factors for your patients, and are you mitigating them? Tracking these KPIs, I know people don't want to do the numbers, they don't want to be in sales, but the reality is it's not sales, it's risk mitigation and identification for your patients, and that is our responsibility. The final pillar at the top, the final skill set, is business excellence. And it's time to get down to business. Hygienists, we need to look at our hygiene departments as a business within a business. We are accountable to the profitability of our hygiene departments, and truly only we can move the needle on our hygiene departments being successful. And an unsuccessful hygiene department is bad for your practice, and it's bad for your patients. If you're doing everything right for your patients, from leadership to teamwork and diplomacy, to the dental medical synergy, to clinical excellence, the numbers will be there. Those numbers just tell you that you're doing all the right things for your patients. So understand your numbers. Again, track KPIs in your hygiene departments to ensure that your hygiene department is successful against national benchmarks. So wrapping back to Stephen Hawking's quote about the no boundaries condition, I hope you understand now that as a hygiene profession, while we may be finite, we are not with boundaries. So hopefully you can take what you learned today here and expand your talent.